Foki Mai. Right here on Early Edition with it 5:31 PI is the station that brings Pacific people together. Dr. Api Talemaitoga is an Auckland-based GP. He is a member of the Pacific Medical Association as well as the Ministry of Health's Pacific Response Team. He was appointed by the government to the New Zealand COVID-19 Surveillance and Testing Strategy Group. Api Talemaitoga is on the line with us now to provide an update with regards to COVID-19 in the Auckland situation and around the country. Nisambula Vinaka, Dr. Talemaitoga, thank you so much for your time.
Oh, thank you very much. Nisambula Vinaka.
Now,
and Talafalava.
Now, I was at yesterday's press conference with the Director General of Health, and he is saying that this is like a roller coaster ride that he didn't buy a ticket for, and I couldn't agree more. How has it been for you, Api? I mean, on Sunday, I thought, oh my goodness, here we go again. It's going to be busy this week talking about COVID-19. But how has it been for you personally each time one of these outbreaks happen?
I guess we've prepared ourselves that this is a scenario that could happen because we know this is how viruses behave. They change, they mutate, the new variants come along, and they're very sneaky. And so community transmission was something that was envisaged. Like Dr. Bloomfield, we hope we didn't have to go on the roller coaster ride. But I turn it around and say, yes, we may not have bought the ticket, but we are on the ride now and we've been here before. We can do it again.
There will be an end, and the end is in sight with vaccines in the country now, but more of that later. Give us the latest update with the Auckland situation, please, Dr. Talemaitoga.
It's really nice to hear the amount of people that lined up to have tests yesterday, and we'll find out today. But as of yesterday, despite the huge number of tests, there were no positive cases identified. We all know that the family of three were found to have the infectious United Kingdom variant, which our scientists and health officials are working really hard to try and identify where the exact identity so they can try and see where this came in. There's lots of theories, most likely from the border, but we need to confirm that. The number of people turning up, I would just make a plea that if you are a close contact, absolutely, you should be front of line to get this test. If you're a classmate of the young girl at Papatoetoe High School, if you worked with her mother at the Sky Chef's place at the airport, or you might have visited and stayed at the family home. But if you're a casual contact, like teachers or other students who may have just come into contact on a very cursory manner, then you have time, especially if you have no symptoms, to wait at home, let the others get tested, and you will get a test just to be sure, but it's just to help the congestion. We're lucky that NRHCC, the Northern Regional DHBs, are planning to open more testing centres, especially one in Takani this morning. And my colleagues in general practice have been working very hard to provide the testing, and I just ask that the community be a bit patient as they collect your data so that you can be properly identified and do the tests. So if in doubt, please ring your GP or health line and ask for advice.
Now, it would be fair also to say that in terms of the Ministry of Health and the district health boards, their processes are pretty good now, aren't they? In terms of tracing the casual contacts and the like and the close contacts. It's pretty efficient
That's
system.
you've
That system.
it's very sleek now, and we should say our thanks to the family first for coming forward and getting tested when they got ill, and second for their diligence in scanning the QR codes to all the businesses and places they visited, including going down to New Plymouth. This has made it really easy and straightforward for our health workers, health authorities to track and trace where they've been while they've been out. And that helps all of us because, for example, the Pack and Save in Cavendish Drive, Manukau, was a place of interest. Everybody who shops there can be seen as a casual contact, allows them the certainty that they too can go and have a test.
And the QR code scanning, those who didn't scan on that day at that particular time may be in danger. And this is why it's important you scan. Because if you scanned at the same time, your system would come up to say you are a close contact. Am I guessing that?
That's absolutely right. And you'd get warning, be warned or be notified that you are a close contact. Go and get yourself tested.
Now, if I have another attack of my gout, do I hold off, worried the doctor might be too busy if I need to get pills?
Uh, that's a really good question, Eti. Um, your doctors, or are all open for business. It's just that they might have changed the way they interact with you. So this is going back to like what we did during the lockdowns last year. So your doctor is still open for business. Please call and ask for an appointment, but you will be offered either a virtual appointment on video, or it would be a phone consult with your doctor. But don't delay. Don't just wait at home with your other illnesses. If you're running out of medication, call your doctor. Pharmacies are open and can provide that or even deliver it to you.
Absolutely. Good messaging. Otherwise, if I don't go, I'm not going to be able to go anywhere as the gout gets worse. Now, vaccines arrived in the country yesterday, Dr. Talemaitoga. Yay! But when do we start getting them?
That's good. So the government's been working really hard through the Ministry of Health to make sure we can uh, facilitate the delivery of these vaccines as efficient as possible. So as everyone knows, it's the Pfizer BioNTech vaccine, which is where you need 2 doses, 3 weeks apart, and the rollout starts this Saturday, and it'll probably, well, maybe it's just because I'm in Auckland. I think it'll start in Auckland, but the people that get the vaccines first are our border workers and staff. So people at security, at the airports, at the ports, the cleaners that work there, even immigration and customs staff. They are first line of defense, if you like. And so they will be offered the vaccines and their close contacts, which I think is really great because we don't want this, because many of whom are Pacific, bringing the virus potentially home when they come. If they're protected, their family are also offered protection. And after that, we will roll it out as more vaccines arrive to frontline health workers like GPs and nurses and people that work in emergency department, also police and defense personnel uh, who are front facing the public most days. The rest of the country, we hope, will get the vaccines, by the middle of the year.
Now, I made sure to ask the Prime Minister yesterday. I have asked this previously of Chris Hipkins, and he reassured me and us that there'll be no questions asked of those who do not have the right visa to stay in the country. And yesterday I asked it of the Prime Minister, and straight from her own mouth, she said that all overstayers will be given free vaccinations with no questions.
It is really good because it's a global public health message. New Zealand is part of the organization of countries that are also supporting the spread of or delivery of vaccines to the poorer countries, if you like, to ensure there is as much equity as possible globally, both in the cost and in the delivery of the vaccines.
Now, the vaccines, are they safe? And what do you say to those who say the process has been rushed?
Yeah, I think it's really good to ask the question, and I have encouraged young people to look online on trusted sources like the Unite Against COVID or the Ministry of Health website to help inform the AINGA, the older people within the family, about the safety. I just want to make a good plea for MedSave. This is the organization of scientists and health officials that work very closely together and are very strict. They look at all medicines and all vaccines coming into the country and will not give approval until they're happy that it's going to be safe on us. So they have given provisional approval, which I think is quite good. That means, yes, you can use it here, but we're going to monitor it closely. And they demand that data is collected on people in Aotearoa and that the company is held to account to deliver other data about the effectiveness of the vaccines overseas, which means we're learning as we're going along. We're delivering the vaccines, but as new things come to light, we can pivot and change whether we reduce the vaccines and give it to people younger than 16 years, but that'll depend on what the new data shows.
And finally, Dr. Talemaitoga, where should people go for more information?
I guess the easiest would be to your doctor and nurse. They will give you the trusted website or source. Either it's at the local DHB or the PHO that your practice or your GP might belong to. And as I mentioned, the COVID, Unite Against COVID website on the Ministry of Health, they'll give you good advice and good links and where to go for more information.
Dr. Api Talemaitoga, thank you for your time and for reassuring us that the structure of the roller coaster is absolutely secure and that the end is inside of this ride. You're listening to Early Edition with it. Common Kings is here with Champion with the time at 7 minutes to 11.